Hi, my name is Nicole Fox. I'm a PA working in family medicine in Southeast Utah for San Juan Health. And here again for our second module, talking about how to screen our patients for obstructive sleep apnea. In our last video, we covered some of the risk factors for obstructive sleep apnea. In this video, we're going to go over further how you can screen patients for this in an office visit and then lead to diagnosis. With the extreme underdiagnosis of sleep apnea, it's really crucial that we as PAs keep this on the differential and appropriately screen and then lead to the pathway for treatment for these patients. Some additional signals for me to screen more during an office visit include obesity or overweight, a patient or a bed partner that comes in talking about some issues with sleeping or some concern for snoring or abnormal noises, airway abnormalities, and especially an elevated diastolic blood pressure. The Journal of Sleep Medicine actually found that an elevated diastolic blood pressure can be more indicative of severe sleep apnea. And for my patients, I often find that this is the case. So if I see an elevated diastolic blood pressure when a patient comes in for an office visit, that's a good clue for me to know that I need to screen more thoroughly for obstructive sleep apnea. I want to dive a little bit deeper into the relationship between obesity and obstructive sleep apnea. We know that this is a bidirectional relationship, so patients that struggle with obesity often tend to have a higher risk and prevalence of OSA, but conversely, OSA also increases the risk of developing obesity over time. We think that this is because, again, of that sympathomimetic activation during the night, and this actually makes it more likely that patients are going to struggle with chronic inflammation, which we know is already an independent risk factor of either disease and then can contribute to development of worsening symptoms with both conditions. It's important to also know that every 10% increase in weight then configures another 6-fold increase in the risk of OSA. So while this can be really problematic with our patients that are struggling with weight gain, this also is a fantastic opportunity for us as clinicians to be able to work with patients to reduce their weight and then reduce the risk of both OSA and the other complications. I had a new patient come into my office recently, and I could tell from their chart when I first looked into it that their BMI was over 30. So that already clued me in that OSA might be part of something that I should consider. There were two things that were really important to go over in that visit. The first, I wanted to ask permission to discuss their weight. They gave me that permission, and then with that permission, I set up another appointment with them to go over risk factors and mitigation strategies for obesity and overweight. In addition, I also completed a validated screening tool with them. There are multiple that are available for use, including the Stop Bang, the ESS or the Epworth sleepiness scale, and the GOAL. I use the Stop Bang because that's what I was familiar with from my own training, but any of these validated questionnaires are wonderful. And you can see different options on your screen to be able to see what seems like it might be realistic for you to work into your clinic flow and what you could either do in your own office visit with the patient or what you can ask your MAs or other associated health professionals in your office to do for you. It's important to know that these questionnaires are validated, but they're not diagnostic. So just because a patient has a high score that's suggestive of sleep apnea, that doesn't mean that we're quite ready to make the diagnosis yet. Tune in for our next video where we'll be going over different ways to both diagnose patients and then figure out a path forward for treatment.